You're listening to Just Medicine, an equity in healthcare podcast created by medical students in British Columbia.
Hi, this is Iman, one of your hosts for the Just Medicine podcast. Today we've got a bit of a different format for you. This will be the first episode on the topic of pediatric gender-affirming care, and it's going to be a solo episode with just me speaking about this topic as it relates to pediatric gender-affirming care in BC specifically. I want to say thank you to the folks at the Gender Clinic at BC Children's Hospital for providing much of the information that's led to making this episode. So today we're going to be focusing more on the services and access to pediatric gender-affirming care. A large focus will be on the Gender Clinic, but a special note is that we will be focusing more on the medical aspects of pediatric gender-affirming care, knowing that this is a bigger topic than what's covered in today's episode. So to start off, I wanted to discuss who would access pediatric gender-affirming care. So as in the name, pediatric populations would be the primary recipients of this care. And that includes anyone from the age of 0, typically up to 17 in BC. And this population would typically identify as gender diverse, trans, non-binary, two-spirit, maybe experiencing gender dysphoria, and other categories that may wish to seek out further tertiary care services for gender-affirming care. So to start off with the initial points of contact in the medical system, for the pediatric age population in BC, primary care services are typically serviced by general practitioners. So typically when there's a need or want for services related to the medical aspects of gender-affirming care, the first point of contact will be a GP. So the level of comfort for a GP in providing services varies a lot, primarily due to potentially comfort or training that the GP received. But well within the scope of a general practitioner would be discussion with the child or youth about their thoughts, their journey, discussion around non-medical options that might help them at this time. This can include things like clothing or exploring binders. And lastly, of course, further connection to resources. This can be pointing them to resources that the child and youth can access themselves, such as much of the resources provided by TransCare BC, or it's going to be a referral to a higher level of service required, such as for the Gender Clinic. But I want to make a note, because the pediatric population is unique, that other specialists might already be involved or might be appropriate to be involved for children and youth with this experience. The first of whom would be pediatricians. Typically, a referral to a pediatrician is done if there is a co-occurring health concern or some other medical complexity. But they can also definitely discuss gender diversity within children and youth as well. And then adolescent medicine specialists, these are pediatricians who have fellowship training in adolescent medicine. And as part of their scope of practice is to be providing services to youth who are gender diverse or might experience gender dysphoria, more so from the category of the social aspects and their environment and their family and how they're fitting in. These other aspects of care, and again, of course, being adolescent medicine, it tends to be teenagers. But this is actually a pretty big component of the specialists involved within this population. And lastly, of course, includes mental health practitioners. This can be psychologists, psychiatrists, counselors. This is typically more so if the child already has a pre-existing mental illness or other concern, and so they already have contact to these professionals, or if they seek them out themselves, such as the case for psychologists and counselors with private funding. And also noting that, unfortunately, a lot of gender diverse youth do experience higher levels of depression, anxiety, eating disorders, suicidality than their peers. But if the child in BC or youth is seeking medical services for addressing physical aspects of their body related to their gender diversity, then they can be referred to the gender clinic. And any of the specialists or any of the medical specialists involved can be referred to gender clinic or provide a referral for a gender clinic. So, an introduction to the gender clinic here in BC. The gender clinic is housed at BC Children's Hospital, and it is an endocrinology clinic providing endocrine services. It is essentially a family-centered but youth-led clinic, and their goal is to focus on helping children and families navigate gender diversity. So why does the clinic exist? It exists because there was a need found within the pediatric population to provide services that involved, for the most part, hormones as a therapeutic route in order to address some of the physical changes that a youth or child may seek on their gender journey. And it was because of the fact that this is a pediatric population, providing this kind of care is a little bit more complex as youth are still developing. They are at different stages in puberty. Some have been exposed to it, some have not. And so most general practitioners or even non-subspecialty pediatricians are not equipped with the training necessary to assume the entirety of this care. So the clinic really exists as a specialist service, namely endocrinology, for these children and youth. So youth have to be referred to the clinic by a medical professional, and the only exclusion criteria is that they cannot be referred for a first-time visit if they are over 17 years old, as again, the clinic caters to a pediatric population. So who is at the gender clinic? These are endocrinology nurses, social workers, endocrinologists, and administration. But closely linked to the clinic will include hospital-based psychologists, psychiatrists, and clinical social workers. And then, as mentioned before, adolescent medicine can play a very strong contact with the clinic, especially for that adolescent population. So once a child is referred to the gender clinic, they need to go through a series of steps before eventually being able to access care from an endocrinologist within this clinic. The first of which is an intake assessment. After that is a mental health assessment that then informs a triage into either a puberty blocker assessment group or a hormone readiness assessment group. We'll talk about each of these as the episode progresses. But the first of these is the intake assessment, and this is the first point of contact with the gender clinic. Typically, this is the youth, the child or youth, and family as well if they're available, who meet with the nurse and the social worker. What they will do at this stage is a gender-specific HEADS assessment. For those of you who don't know, a HEADS assessment is typically a tool employed in more adolescent populations in order to discuss with youth at their medical visit the more social aspects of their environment. And so this includes chatting about their home environment, their education, any activities they do, any drugs that they might be exposed to, and then also their social environment, their sexuality, and suicidality. But they'll typically do this at this assessment because they really want to know and provide holistic care for the youth in that sense. So they'll chat about things such as where they're at with their gender diversity. Do they live with people who are aware of their thoughts or not? Do they have supports at school? Are they involved in any extracurriculars, and are they being supported in those extracurriculars? Do they have any mental health that co-occurs in their life? And then they'll really focus in on the gender journey specifically, their experience with gender. And because this is an endocrinology clinic, there is going to be a bit of a focus on their physical body. So they might chat about how they feel about their body. Do they have any distress relating to it? They'll chat about options for clothing that might help in the interim, or if they've experimented with anything. And they'll chat about puberty as well if they're close to that age, and just to make sure that they have some education around that. Essentially, the clinic really likes to follow the lead of the youth and tries to tailor this intake assessment as much to the youth as possible, while also gathering necessary information for further care. And this all culminates until the end of the appointment that kind of depends on the youth's goal and tries to tailor it to them. But they will always try to focus a little bit on reaching some goals outside of just the medical aspects. So these are things such as chatting with family and giving tips and pointers of how to do that if that conversation hasn't been started, how to navigate school, any resources. And some people, on the other hand, are very focused on a more medical transition. So at this stage, they might chat a little bit about hormones and kind of give them a little preview of what's to come. Some kids and youth might just stop at this step after the intake assessment. They might feel satisfied with being connected at this time and with the information that they've received, and don't necessarily want or require further steps. And so sometimes after the intake assessment, it's a bit of a pause, depending on the youth and their opinions on where they're at. But for other kids, they'll have to be kind of triaged to the next level of service. But the next step that is necessary, that will inform much of the next part, will be the mental health assessment. So the purpose of the mental health assessment has a few different components. One is to have a professional ascertain that there is an experience of gender incongruence in the child, and that other areas that could cause differences would be ruled out. There would also be a need to have a professional discuss capacity to consent. This is particularly important in kids who are at different developmental stages, who might be neurodiverse. And lastly, to identify if there are any co-occurring mental health concerns that would be relevant, especially with body changes. Things like eating disorders become very important to know. And the purpose of the mental health assessment was established in the standards of care for the health of transsexual, transgender, and gender. And this is a guideline essentially provided to medical professionals by the World Professional Association for Transgender Health. Essentially, these guidelines do recommend that a trans-competent mental health professional assess the gender diversity in youth prior to actually initiating medical treatment. And the professionals who can undergo these assessments are psychiatrists, psychologists, registered clinical social workers for the most part, but then in some cases, some adolescent medicine specialists or pediatricians may feel equipped. Essentially, it's somebody who is able to have a full grasp of the DSM and is able to make this assessment and rule out the necessary disorders in this particular situation. And of course, along with that, the goals will be to also assess a child or youth's readiness in order to progress within their gender journey, and to also address any family dynamics at play, the level of support that the youth has, a lot of focus on social aspects of care. And now I just wanted to make a brief note on gender dysphoria, because gender dysphoria is a DSM-5 diagnosis, and the initial definition would be a marked incongruence between one's experienced or expressed gender and assigned gender of at least 6 months of duration. It's manifested by 6 of 8 criteria in the DSM, and importantly, also requires that the condition is associated with clinically significant distress or impairment in social, school, or other important areas of functioning. So there's a lot of difference of opinion regarding whether a diagnosis of gender dysphoria is relevant, whether it's necessary, and whether it should even exist. For the case of the gender clinic, the experts have told us that essentially what they're finding is that many of the youth that come through the clinic are actually brought up in comfortable environments where they don't actually get to a point where they have to contend with their bodies not turning out the way that they want them to be. So a lot of kids who may have had gender dysphoria and other non-supportive environmental circumstances end up not really expressing, especially that second part of functional impairment. So overall, here in BC, a youth does not need the diagnosis of gender dysphoria in order to continue with care. However, I will note that there is some differences depending where you are in the world and what type of services you need, where that is still a requirement in order to further access care. One thing to note about the mental health assessment is that it is just that. It is an assessment, and it is not necessarily formally diagnosing certain conditions. This becomes very relevant for complex conditions that require more information than one assessment. So this can be, for example, along the autism spectrum disorder, where you would really need a comprehensive psychoeducational assessment for this, or something like ADHD, where multiple reports would be required for corroboration. So the mental health assessment is more so just to give a snapshot of the mental health, but it's importantly for those other areas that we discussed. The mental health assessment can also be done by any of those professionals that I mentioned earlier, and does not necessarily have to be done by the clinic. However, of course, in BC, services to psychologists or registered clinical social workers, counselors are not covered by MSP, and so typically there would need to be a child or youth whose family can help fund these through extended benefits, for example. So for kids who do not have access to this funding or this type of benefit, they can go through the clinic to achieve the assessment by the hospital-based psychiatrists, psychologists, or clinical social workers. Some kids have already been connected to these mental health professionals prior to even getting referred to the clinic, and so some kids actually come with the assessment already done. and that's totally acceptable. It can be used to further help triage them, essentially. So after the information from the mental health assessment and the intake assessment, kids are then kind of in two categories. They're either going to go into the puberty blocker category or the hormone readiness assessment category. Or, of course, actually the third option, where there might be a pause, where some kids might not feel the need to necessarily take further medical intervention steps at this time. I'll speak first about the puberty blocker assessment. So this is a very particular category. This is for kids who are more along the kind of emergency route, meaning kids who have been identified as shortly going into puberty but are essentially not functioning very well with this contention. So essentially, the clinic tries to triage these kids who are in severe distress or not functioning well in their environment more quickly and help establish essentially treatment earlier so that they're able to hopefully provide one benefit in the interim that might be of great help for them. However, as part of the greater picture as well, this can be difficult to identify. The clinic receives quite a few referrals, and so it can be difficult to triage in these cases. And there's also still a need to discuss the importance of starting such a therapy as well. So now we'll talk a little bit about the hormone readiness assessment. This is the one that most kids will eventually go through if they choose to further seek care here. And by the time kids are at this stage, they're typically pretty on board with wanting to start hormones. They've thought about it. They might have researched it. They've hopefully discussed it with the intake meeting and with the mental health assessment. So they have an idea. And this is prior to meeting with the endocrinologist. But at the same time, there is still a few important aspects that kids need to understand here. So for one, kids who go through hormones will have to go through puberty anyway, and kids who go through the hormone assessment will have to be exposed to puberty blockers as well. And it's really important to stress that puberty blockers can't be a solution forever, and eventually children need to be exposed through puberty. And there also needs to be certain conversations around fertility. There needs to be conversations around logistics for the care. But essentially, and we'll discuss the intricacies a little bit more in the next episode, but the hormone readiness is primarily to meet with the endocrinologist, and they will discuss more about this treatment option for them and what that looks like. And now for a few notes about the gender clinic itself. So it's actually a very busy clinic. It received well over 700 referrals in 2022, and yet the clinic is quite small. The waitlist length essentially depends on the route that the child or youth is taking, to the type of care that they might need. So, for example, if there's a youth who needs a publicly funded mental health assessment, such that they don't have extended benefits or access to financial means to fund this assessment themselves, and they also eventually seek hormones, then it might take up to 1.5 years until they actually start the treatment. And that can only happen after meeting with an endocrinologist, with breaks and pauses in between to wait for each of these assessments. The shortest wait might be a child who is very close to puberty, can essentially pay out of pocket for an assessment and so seeks that privately. That could be about 6 to 9 months wait, and that's only because they get to those assessments more quickly. And the average overall would be between 8 months to 2 years. And next, I just wanted to make a note on families, as this is a pediatric clinic. So recall that I mentioned this was a family-centered but youth-led clinic. And the clinic has shared that the number one prognostic factor that points to how well children and youth facing gender diversity do is that they have an adult, typically a parent, but really any adult who is supportive. So the goal of the clinic is really to have whoever that support person is for the youth to be supportive and well educated. A lot of that intake assessment will speak about education to parents, power of affirming children and youth, how withholding gender affirming services affects mental health in this population greatly. They may recommend counseling or family-centered therapy, and essentially a conversation about getting to the bottom of concern of parents. There is a lot of confusion around what these hormones or treatments might do, and so it's really a big part of the clinic's job is to provide education to the clinics as well, and to try to have as many people on board for the youth in support as possible. For kids who may be under the care of, for example, the MCFD, this becomes a little bit more intricate, but MCFD is typically supportive of these decisions. It is very rare that a youth gets to make their own decision, and typically in these exceptional circumstances, there has been an ethicist also involved. And lastly, a note on funding, which is where also that potentially familial support comes into play. The puberty blockers are what are exceptionally costly, and most people who have extended benefits can have a viable way of covering this. But for those who might not have access to this or might not have support in order to receive funding options, then the clinic tries their best to find a way for the youth to still access the service. And for just a few misconceptions of the clinic, one would be that this is a endocrinology clinic and there is actually no counseling available at the clinic. It is not within the capacity of the clinic, and they do not have the professional expertise to provide those kinds of services. So the more social aspects of being a gender diverse youth are not really met by the clinic, but they can sure point to resources that might help. And often going through the medical components can really help the child be on their way to at least one step in bettering their mental health. Secondly, is that sometimes there is this thought that there would be pressure to progress throughout the clinic and to receive more services than they need. But as mentioned, the clinic is really youth-led, and so they really leave it up to the child to know what the next steps could be, what's viable for them, what they seek in this type of treatment plan. And so there's never any pressure to continue or to go to the next step. I mean, really, it's very tailored to the child. So in summary, for children and youth who identify as gender diverse or trans, non-binary, two-spirit in BC, will typically first seek their GP in order to first have a discussion on the medical aspects of treatment that they might seek of affirming care. After discussing with their GP, they then get referred to either another specialist, depending on the circumstance, or they can be referred to the gender clinic. And the gender clinic is an endocrinology clinic trying to provide services to children and youth in BC who seek to have physical changes on their gender journey as a youth. And within this clinic, there are certain steps involved, such as the intake assessment, the mental health assessment, in order to get a comprehensive overview of the child and their situation, and eventually be able to provide the hormone treatments that they may want or require. And that ends our first episode on the topic of pediatric gender affirming care. Thank you so much for listening. And in part 2, we will be speaking more about the medical aspects of care, what are puberty blockers, what is hormone therapies, and more of the intricacies of what happens after a youth meets with an endocrinologist at the gender clinic.
Thanks for tuning in to Just Medicine.